After almost 2 years of testing for COVID, you'd think that any debate over how to do it would be settled, but no. The new question, what's better to swab, your nose or your throat? Some doctors say we might need to adapt our testing methods given the spread of Omicron.
It may also address the issue of false results on at-home tests. Meghan Schiller explains the pros and cons of where you swab.
Some medical experts suggest we try a new method for testing for COVID-19's Omicron variant. Many people are struggling with sore throats, claiming when they do a test with a nasal swab, they're testing negative, but as soon as they swab their throats, the results change. Just scroll through #science Twitter and you'll find the people trying it out. This woman tweeting her positive results, saying, quote, "Well, there it is. I finally took Twitter advice and swabbed my throat as well as my nose." One doctor retweeting her saying, quote, "Omicron is different. We must adapt." Dr. Amesh Adalja tells me, why not try?
And that's especially going to be true if someone doesn't have nasal symptoms and they maybe only have a sore throat. It may be better just to swab the back of the throat before you clear them.
Dr. Adalja says we're learning Omicron is more associated with sore throats than other variants, and the test would look just like a strep test.
If they test negative with the nasal swab, and they have sore throat symptoms, it might be worth doing another swab of the back of your throat. Either you do it yourself with one of those home kits or have one of your friends swab the back of your throat, because people need to know their status, because if it's not COVID, maybe it is strep throat, maybe it's something else that needs treatment.
Amidst the throat swab debate, the FDA issued guidance saying, quote, "The FDA advises that COVID-19 tests should be used as authorized, including following their instructions or use regarding obtaining the sample for testing. The FDA has noted safety concerns regarding self-collection of throat swabs, as they are more complicated than nasal swabs, and if used incorrectly, can cause harm to the patient." Moms like Sarah Arenas just want to know, how can she keep her kids safe and find a test if they're sick?
I do know the Walgreens in North Huntington had a shelf full of tests. I know people were literally just grabbing them by like the handfuls. I do know MedExpress. I do know I had called when my husband and I both had COVID, and they said it would be over 2 hours to wait to get tested. So, and I think that's a long wait.
Ultimately, doctors say if you're feeling sick, assume you're positive until proven otherwise. Coming up tonight at 6, more from Science Twitter. Hear from the people who say this is happening to them and they're posting their positive results as proof. That's tonight at 6. For now, reporting tonight, Meghan Schiller, KDKA News.